We review our database registry that started at our hospital in 2004 to select those patients that have been treated with concurrent chemo and radiotherapy in stage 3 lung cancer in clinical practice. Because few elderly patients are in the randomized studies of concurrent chemo and radiotherapy.
The concurrent chemoradiotherapy is a powerful modality, so why were you looking at comparing that with younger and older patients?
We compare if the chemotherapy we use to concomitate with radiotherapy has an impact in overall survival, because the standard of care is cisplatin combination, but less elderly patients are suitable for cisplatin combination.
What did you find?
We found that it seems that it doesn't matter the kind of chemotherapy you use. We find that the most important thing is the total dose of radiotherapy you treat the patient.
So what are the clinical messages then coming out of this for doctors?
Probably our clinical message is, first you have to apply an geriatric approach, because all our elderly patients were based on a geriatric approach. And then if the patients are fit or vulnerable, no frail patients, you can choose the kind of chemotherapy to treat them. It doesn't matter if you don't use cisplatin to combine with radiotherapy.
Let me get an understanding of this then. You might have a situation where you would be reluctant to use a harsh therapy on older patients, but are you saying now that you can go ahead?
Yes. Yes, probably they benefit for concurrent chemo and radiotherapy, but with adapted regimen, similar to palliative treatment.
So you'd avoid cisplatin, maybe?
No, carboplatin. I prefer carboplatin for elderly patients.
Right. So what then, if you were to summarize the findings for cancer doctors, what should they remember from this study?
You don't have to avoid concurrent chemo and radiotherapy only by age criteria. They benefit from concurrent and chemoradiotherapy, but probably you have to adapt the chemotherapy schedule you use for elderly patients.
And in practical terms, up to what sort of age are you talking about?
In practical terms, that you can use either cisplatin or carboplatin, or prefer carboplatin to concomitate.
And is there an age limit for going ahead with this, with chemoradiotherapy?
I'm not sure if there's an age limit, but we found in the clinical practice that there was a younger elderly populations. The median age for elderly was only 73. So probably more than 80 years old is difficult to avoid for concurrent chemo and radiotherapy.